My husband Gary had been ill for several years. He had a lot of heart problems. He'd had 3 open heart surgeries. He had an LVAD, which is basically a heart pump that's planted in his heart and run on batteries that very few people have. So it's kind of unusual. And his health started to decline. He was on oxygen and had back issues, was just not very mobile and having a hard time getting around. And there came a point where, through tests with the cardiologist, blood work and heart catheter test, they determined that the right side of his heart was failing, and they recommended palliative care.
Because of his situation with the LVAD, the handoff with palliative care and then ultimately hospice care was unique in that his doctors, who were heavily involved in his care before, had to really hand off care to Paradigm, which required the team at Paradigm to learn a lot about the LVAD, the functionality, how it was working within his body and what he was going through. And the team that Chastity was first, and then the hospice team that came in were so incredible at asking the right questions, but they also, I think we've talked about this later, sat back and really just observed. And we realized that them sitting there was also sort of taking into account family dynamics, the living dynamics, and him and his current state and what he was going through. And he was very mentally aware all the way to the end and able to speak on behalf of what he wanted.
The thing I liked too was they involved Gary in everything. They didn't make it sound like they were talking about him in front of him, where it would be awkward for him. They were very sensitive to his questions and his needs and how he wanted this whole process to play out.
They were great with us as family members, caring for him and setting expectations as people are coming and going of, this is what you can expect next, and this is when you need to call me, because we didn't know that.
No, right.
And so for us to be able to, know this is when we can call. And the furthest person I think was 20 minutes away, but they really weren't. We found out they were sitting around the corner at a Starbucks waiting for the call.
Waiting, knowing we would probably call.
Yeah, and and Joni especially, and the nurses were so great about giving us our space and not being too in the mix, but then also being really available when we needed them. And it was, I couldn't have wrote a better story.
No.
Yeah.
And then the day he passed, that morning, we didn't realize it was going to be that day, but we knew it would be soon. The nurse, Joni, she came and she pretty much stayed all day. And she helped with the morphine. She helped with everything we needed help with, and was able to talk us through what was happening and guide us along. And I'll never forget her. She was wonderful. I still remember her being there, and I'm so grateful that, because we did have to deal with the LVAD, which was a special situation, and we had to at some point deal with turning that off as he's passing. And she walked us through that and helped us with that. And it was, if you can say, a beautiful moment when someone passes, but it was.
It was.